Hi everyone, welcome to today's Ask Me Anything event. I'm Alexandra, the brand educator here at MDPen, and I'm so excited to have Kaylin with me today. She is from St. Cloud, Minnesota, and her skincare lounge is called Simply Serene Aesthetic Bar. They do have the MDPen. She is super knowledgeable. She has 7 years of experience as an advanced practice esthetician and loves microneedling. And today we're going to talk to you guys about how you can create a summer treatment plan with MDPen. Do participate in the comments. We love to hear from you guys. We will try to answer as many questions as possible. This is streaming to Facebook and LinkedIn. So yeah, I'll be checking both. So hi, Kaylin.
Hello.
Thank you so much for being here.
Thanks for having me.
Can you tell our audience a little bit about your background as an esthetician?
Yes. So I'm an advanced practice esthetician in the state of Minnesota. I obtained my advanced practice license about 4 years ago. The state started transforming things, but I was doing advanced practice treatments before then. So I just got my extra license within it, and then I joined Simply Serene Aesthetic Bar, where now I'm doing more medical grade treatments because I have that medical director with me as well. So it's been a great experience being able to add in more medical grade and to be able to provide that.
Yeah, I know we were talking previously, and I've always favored, of course, medical grade treatments myself. I know you were saying you love the patient satisfaction rate of medical grade treatments and just being able to meet their needs and their expectations. You know, it's a really big deal. What's the schooling like for like an advanced practice esthetician? Is it much longer or?
It is. When I was able to obtain the license, it was at a time where either you had to test out of it or you had to go back to school and get more hours, or you could prove your hours. Within that, I had my hours, but I didn't feel comfortable being able to just write them all down and say, this is what I had. So I did end up doing the testing, and it was on a lot of things that I haven't practiced personally, but I had to take that time and learn more about it. So it kind of boosted me up within that too, to be able to be like, okay, I can do more medical grade treatments and more advanced treatments, and I have this knowledge behind it as well.
Wonderful. Yes, I can
Yeah.
tell you're confident, you know what you're doing. And Kaylin is obviously the lead master esthetician where she's at. So when we talk about creating a summer treatment plan, we're going to kind of talk about it from a new patient perspective. However, you should kind of treat your existing patients pretty much the same way because microneedling in this instance is totally new to them, most likely. And even if they've had microneedling somewhere else, don't assume that it's, you know, the same protocol, the same aftercare, the same way you're going to treat things. So what we kind of want to do now is break down the consultation. So Kaylin, I'd love to hear, you know, how you go about this, what all you like to accomplish at the time of a new patient consult.
Absolutely. So usually when I have somebody come in who's a new patient who is coming in with any skin concern, I like to sit down and ask them questions about what their goals are, what they would like to achieve within their skincare routine as well. So it's usually within then. And then I even ask, I'm like, have you done certain advanced treatments before? And at times they say yes, but they haven't received the results that they would like to be receiving, or they say no. And then I kind of go into more of what I would suggest from there. And it really is breaking down what current products you're even using and what products you would like to want to even add into your routine. How dedicated you are to wanting to come in um, monthly or even quarterly. And I also like to kind of get into your lifestyle. Will you be outside in the sun more? And do you have vacations coming up? Just asking some of those questions too.
100%. Those questions are especially important during the summer, those lifestyle questions, because people are definitely doing things that they wouldn't typically do year round, and they may forget. So you may have to pry a little bit, finding out about their time in the sun, finding out about vacation, things like this. We did just get a question come in that's definitely relevant to this conversation. Mosh is asking, do you think it's helpful if clients bring their current skincare products to the consult?
Absolutely. I do usually ask my clients to bring in everything that they have, even if it is just even a basic facial that they're coming in and getting. I like to just see what they're using and how comfortable they are with it too. And some of it is stuff that they don't even need to be using, or they're using too much of active ingredients. So just within that consult, we can get so much accomplished and kind of to simplify it as well.
Yeah, 100%. A lot of times people, and you may not know the exact name of the product, you may not know all the
Mhm.
ingredients, and it's just so much easier. And if your office has a front desk person that can really get in the habit, when they're scheduling those appointments, of just going ahead and saying, like, our esthetician would love it if you are able to bring your current skincare with you, and it can definitely be helpful. So thank you for asking that. um, I see a few more questions coming in. Okay, here's a great one. Can a facial be done at the time of the initial consultation?
At times I do. It's really situational as well, of how much time did the patient kind of plan out for them to be coming in? Like, was it a quick chat, or did they want some hands-on, like a facial from it? And I really do enjoy to be able to take that time and really feel the skin too. So it would almost be like a mini facial within it, of just really being able to see and analyze the skin in a different way.
Yeah, 100%. I mean, the consult can be as short or as long as you want it to, or how you want your schedule to be. Obviously, if it's just a consult, just reviewing skincare, maybe talking about microneedling, if that's the purpose of the appointment, you can get away with half an hour. If you
Yeah.
plan to do a facial, obviously you have to block off time. So my advice would just be to make sure that you have the time for it. And also, as Kaylin was saying, you don't want to overwhelm the patient. So it kind of depends to how experienced they are with these services, um, and having advanced services done. So great. Since we did just talk about the consultation, let's kind of get into um, how you talk about microneedling and preparing the client for the service. I already see questions coming in. I know people are excited to hear about microneedling. We do have someone asking, like, how did you find, or what did you do to kind of practice the treatment as you were learning? How did you gain your knowledge that way?
Yeah. As I was learning, I would kind of pull anyone within the office and just say, let me do a treatment quick on you. Um, so then I could get the feeling too of working with other skin, of men, women, and just how the skin is very different and going against the hair at times. Um, I would do it within myself as well, and being able to know the depth and feeling of it and what I can let my patients know too as what they can expect. Um, I would I would always just kind of be playing around with it, and then once I got more comfortable, I definitely ran some more specials, and then I got more people within the door, and then I saw how I could increase the results as well.
100%. That's great advice. I mean, obviously, with MDPen, and if you buy right now, we have a special where it includes in-office training, which does give you, your staff, half a day of hands-on experience. But it is great to tell friends, tell family, existing patients, things like this. And of course, I don't want to get too much off topic, but you can also practice with our refined needle, which is our nano needle, painless, no numbing required. So there's a lot of ways, to get that bit of practice in. So getting back to the topic, creating your summer treatment plan, we've done the consultation. Where do you go from there, Kaylin? What is like the first next thing they're going to do? What are they going to come in for?
After the consultation, that's usually when I go through what we think would be the best series or plan for the skin. That's normally how I do a lot of my treatments, is kind of planning it out within a 3-month span, just for you to get the best results. Because usually one treatment is great and it might be maintenance for you, but some other people may need just a little bit more time to work on the targeted areas. So after we create a plan of going through if microneedling is the best option for you throughout that whole time, or if maybe we should add in something else during that time too. So usually from there, we'll plan it out, looking at their schedule too, just to make sure you're not going to the lake that next weekend, or you don't have like a big wedding or any big event kind of coming up before then immediately. So I like to look through that a little bit. And then once they come in, I explain the whole process of how the microneedling will go and what they think that or what I typically see as the after result and how to go through their aftercare. And then we decide on a plan, and then usually the first step is microneedling because it does get that great collagen production in the area.
Yeah, just to answer this question real quick, what are the rules about skin exposure after microneedling? So as Kaylin was saying, and she and I have had this conversation, 1 week is a general rule for no direct long-term sun exposure. So you don't want, again, the patient going to the pool, playing outdoor sports, going on vacation where they'd be walking outside in the sun. So nothing more than, walking to the grocery store, walking to the mailbox, maybe a 20-minute walk with a sunscreen and a hat. The first 24 hours are obviously vital to mostly staying indoors. But 1 week, you want to kind of follow that exact rule, even if it means you rescheduling their appointment. Yes, you want the the income, the payment, but it's better to reschedule the patient. You do not want to treat someone that you know is going to be doing those things. And we will talk more about the aftercare here. So as Kaylin was saying, yes, planning things over a 3 to 4 month period is perfect. Also, the first treatment you want to start someone with is generally, yes, that facial. And you want to start them with a facial for many reasons. You want to make sure that their skin is nicely exfoliated. Especially in the summer, people are more acneic, people are more oily. You want to clean out any congestion you can. This is going to make them less prone to purging after the treatment, and they're going to have a much better result from the first treatment, typically less downtime too if they have done the facial in advance. So this is going to go for any skin type we're going to talk about when it comes to summer skin concerns. So this is anything from hyperpigmentation, melasma, oily skin, dry, mature skin, and anything else really. Always start with a facial. This is also a good time to really do the skin analysis, which you may have somewhat been able to do at the consultation, but this is going to be an even more, extreme skin analysis. And the facial can be done, 1 to 2 weeks prior to the microneedling service. I've seen it done day of, but then you want to remember that it becomes a multiple treatment, multiple treatments in the same visit. So if they are able to come in, twice, that's better. And again, keeping it in that, 3-4 month window there. Any other reasons you do the facial, Kaylin, up front?
I really do like to do an advanced exfoliation more with some extractions, if needed, and really just to be able to feel the skin and to see as well, like if it is more compromised in some areas. And then that does help me kind of create their plan even more and to get some products too within there, because that home care is very important to continue with, and even for prepping the skin for the microneedling.
Absolutely. And that's a great way to not overwhelm them at the consult visit. You could go into microneedling aftercare, after the facial, sitting down and having that conversation about the aftercare, about what to expect. Also, if they're prepaying for the facial with their microneedling series, everything can be done in that visit. That way, when they do start coming in for their microneedling series, they can walk right out the door
Mhm.
afterwards. Everything's prepaid. They have their aftercare. Everything's written down. So let's talk first about hyperpigmentation. Obviously, there's only certain products they can use immediately following the treatment. And then there's, products that they're going to resume within that week and the rest of the month to treat
Mhm.
their hyperpigmentation. What are some of your favorites for hyperpigmentation during the summer?
Within the summer, SPF, all-time favorite, especially with some hyperpigmentation, and just being able to know within these summer months too how easy it is to continue that hyperpigmentation as well, and how important it is to be protected when you go outside. So wearing your SPF hats, being careful with that sun. Um, but loving a retinol, the CNE serum as well to continue after the microneedling.
Yeah, so C and E brightening serum is definitely a must-have, pretty much for everyone. And then also, yes, for hyperpigmentation, PIH, melasma patients. CE, this would be resumed like 3 days after the treatment. You don't want to use this the day following microneedling. The skin can still be, more susceptible, more irritable. So with vitamin C, you would start it 3 days out. This is something they're going to use every morning. It also makes your sunscreen more effective. Absolutely, people with hyperpigmentation, really need to be on a strong physical sunscreen, sometimes zinc oxide based, at the discretion of their practitioner, whatever they're recommending. Typically, people that are prone to melasma, I mean, even walking to the mailbox in the summer, like they cannot leave their skin exposed. So, yes, CE serum for sure, sunscreen, moisturizer, all of the things. And then, of course, your traditional aftercare. Kaylin mentioned retinol. We do have retinol here with MDPen as well. If you guys do want to go shopping for any of these products mentioned, FYI, just so you know, I do have a shopping code for you. It's going to be micro07, and you can use that to shop our retail store. So yeah, let's keep getting kind of like through these skin types. So we've covered hyperpigmentation. Let's talk about people with acne scarring. What are some of your favorites for like the treatment glide and the post care?
Um, love the hyaluronic acid serum, my all-time favorite. And that's great, I think, for a lot of the skin types when I am needling. But then for post care, I'm loving this CNE or the cellular renewal serum as well.
Yeah, cellular renewal, absolutely for scarring. You can needle with it as well, or you can use the HA. Both are amazing. Our HA only has 5 ingredients. Cellular renewal is definitely indicated for skin barrier, for scarring. And this is gonna, the stretch marks category does fall into scarring. So this is also a wonderful treatment glide when you guys are needling stretch marks. Kaylin's mentioned that. um, Cellular renewal. And of course, with scars as well, we have to mention the human derived growth factor gel, which would be applied at the very end of the treatment, but also something that the patient can invest in. And yes, it is an investment. It's the most, I guess, expensive product for most medical grade skincare lines, but very much worth it. Our human derived growth factor gel has 540 epidermal growth factors. We make it in 2 sizes. So when you guys are treating scarring, make sure you're applying this at the end of the treatment. Even if you're doing PRP, you can put this on afterwards for the patient, getting those really nice growth factors in. So when we're talking about like oily skin, acne prone skin, maybe they don't have, the acne scarring or anything severe like that. What are some of your favorite moisturizers for someone who's just plain oily?
I really do like the Tighten and Lift, well, for the serum as well. And then the copper mist. I, throughout the day, tell my patients to just use that to keep their skin kind of at bay. And even for myself, I'm not typically super oily, but throughout the day, especially in these summer months, I kind of miss myself.
Yeah, 100%. And I have to be, I mean, I run oily and I live in Florida, so I get more oily in the summer. And, you can't be washing your face every time you're oily, which
Right.
I would love to do because I love cleanser, but no, you cannot. So doing something like the HA copper mist is ideal. The HA copper mist is also ideal post-treatment because you don't have to touch your face. So every, couple hours you keep misting, but it's also like an everyday must have for all skin types, especially oily skin, because of that zinc ingredient. It's going to really help control your oil, your sebum production. It can be used over makeup. It can be used over sunscreen. So thank you for bringing up that product. Absolutely. Another thing too, if you're very oily and also sensitive, keep in mind that pure HA only has 5 ingredients. The Tighten and Lift serum that Kaylin mentioned is also very nice for oily, acne-prone skin. It's going to have that little bit of alpha hydroxy acid from the lactic acid ingredient. It's also going to have green tea, which is going to help calm and fade your PIH if you have any. Green tea is also a very powerful antioxidant, of course. So those are all going to be wonderful. And the microneedling is also going to help control that T-zone. So areas where you're more oily, the microneedling helps, make it less oily. Areas where you're more dry, it's really going to help balance your skin overall. And that is a difference that people can often see within that first month, which is, super satisfying. So yeah, let's talk about dry, mature skin now. What are your favorites?
Um, the hydrating growth factor, just to have a little bit extra moisture and barrier protection to the skin. And then again, that tighten and lift too will just really help give them those added results.
Yeah, 100%. I know we talk about Tighten and Lift a lot with oily and acneic, just like I just did, but Tighten and Lift is also really good for dry, mature skin types, even as an everyday product. And they don't even have to use it on their whole face. It can be used on areas where you want tightening and lifting. So it's wonderful around the eyes. Again, that green tea is going to help with any dark circles, tightening, lifting, the lower face, the jawline. It will not dry out their skin. So don't let the little bit of lactic acid scare you. It is completely offset by the moisturizing ingredients in there. So it is also a product for dry, mature skin. And again, a great way to sneak in those alpha hydroxy acids that are, more tolerable. Absolutely, the growth factor gel. These are like really going to be hydrating for the skin, and our Revita peptide moisture cream, of course, amino acids, peptides. And I know we don't talk about the Revita a lot in combination with microneedling, but this is a safe moisturizer post microneedling as well. This is an all-encompassing moisturizer. It's not going to have SPF in it, but it's going to have pretty much everything else. And the dosed pump is really nice. It feels so soothing after microneedling, and very creamy. It also has a growth factor for the neck in here. So dry, mature skin, this is a must-have from MDPen. You've got to have the Revita peptide product. There was a few questions I know we haven't answered, so I'm going to go back and kind of find them here. Let's see. Okay, here's a good one. If someone really wants microneedling but is pregnant or breastfeeding, what would be a good alternative in the meantime? So this definitely comes up. What's your opinion on this?
What I would personally do is probably go with some facials during that meantime of getting their skin in a place that it's balanced while doing what they can with it, and then getting them on some home care in that meantime, and then creating a treatment plan that might even be a couple months out, until after they're finished breastfeeding, and to be able to say, okay, now is when we're going to start doing some more advanced treatments that we can do.
Absolutely. So, again, doing those customized facials, and tell your patients, since you are I'm speaking to you as a medical grade spa and office. This is not a typical day spa facial. It can be relaxing, but it's not necessarily, it's more like to change your skin, because a lot of times think people, oh, I can get a facial anywhere, but this
Right.
is totally different. This is so customized. Estheticians like Kaylin have a whole toolbox of things they can use during a facial. So never think of it as, just a facial, because it's definitely not. I tell our MDPen customers, we do have two types of needles for the pen. One is called Refine. This is our nano needle. This would be safe because you don't have to use numbing and it is painless. So this is safe for pregnancy or breastfeeding. Of course, you want to make sure the products you're using are safe at the time of the treatment. And having this Refine facial or nano needling facial on your menu is a great addition. There's people that aren't pregnant or aren't breastfeeding that will also love it. It will give some exfoliation. It's going to plump the skin and help with product absorption. And it's a great little preview of traditional microneedling, which, they can always come back for again, like Kaylin
Yeah.
said, after breastfeeding. So definitely something to think about there. Anything else that we've missed? I'm just going through the comments here. Thank you guys so much for this participation. So I have to ask, Kaylin, what's your favorite summer skincare product? What's your must-have? I think I already know the answer.
I do love SPF just all the time in the summer, but also that copper HA mist has really been my go-to of having it with me just even when I'm out and in between clients too, just to give like myself a nice little refresh.
Yeah, 100% agree with you. Sunscreen is the most important, and when you're meeting a new patient and setting up their regimen, if you don't have them on board with using a sunscreen, like you've missed the mark. It's got to be the first place that you go. It's okay to have a different sunscreen for your face, a different sunscreen for your body. It's an investment, and it's a must have when you are doing these types of treatments. The sunscreen that you use in the winter may need to be totally different from the sunscreen that you use in the summer, and that's okay. There's tinted sunscreens that are physical sunscreens where you can avoid, having the need for concealer or makeup the next day. So there's tons of choices. You just have to find the sunscreen that's right for you, for sure. And the HA Copper Mist is a year-round product, but absolutely a must-have for the summer. I completely agree.
Yeah.
So thank you guys so much for all of your participation today. The code will be good for shopping for the next 48 hours in our retail store. I want to thank Kaylin so much. And if you guys are ever in St. Paul, is it
St. Cloud.
Cloud? Okay, yeah, I wanted to
Yeah.
say St. Paul, but I'm like, it's St. Cloud. St. Cloud, Minnesota. Definitely see Kaylin and go to her med spa. We'll have her information in the comments so you can find her and her spa on Instagram and all of our platforms, and definitely follow her. And yeah, thank you guys so much. Have a great weekend.
Thanks.
Bye.
Bye.